Hi, my name is Eric Holmboe, and I'm the Chief Medical Officer at the American Board of Internal Medicine. Today, I want to talk about the importance of systems in graduate medical education. The reason it's important to talk about systems is that graduate medical education is in the midst of a major transformation. There is growing public pressure to reform medical education to meet the needs of the public, but there's also recognition from the medical education community itself that it also needs to change to meet the needs of our population for the 21st century. I'd like to cover these objectives as part of this talk today. The first is to provide a definition and the role of something called microsystems in graduate medical education. We'll spend a little bit of time really looking at the role of microsystems and their importance in graduate medical education. Second, I'd like to outline the specific competencies residents, and in fact all medical trainees, will need for independent practice. And finally, we'll take as an example important transitions that occur during education that have major system issues associated with them. But first, let's start with the definition of quality. Ultimately, we want the medical education enterprise to produce physicians and other healthcare providers that are truly competent to enter unsupervised practice and provide high quality of care. We know at the current time that the quality and safety of the U.S. healthcare system is far below where it needs to be. So this definition helps to frame what we're trying to accomplish with our focus on systems as part of the medical education system itself. Good quality means providing patients with appropriate services in a technically competent manner, with good communication, shared decision-making, and with cultural sensitivity. This definition was first promulgated by the Institute of Medicine back in 2001 as part of the Crossing the Quality Chasm report. This is a diagram that comes from Paul Batalden and Frank Davidoff. And as you can see from the bottom of the slide, what is quality improvement and how can it transform healthcare is a very good question as we approach this particular diagram. This diagram highlights what the fundamental needs of a health system are. It starts with making sure patients receive better outcomes, or the populations receive better outcomes. As part of that process, you need to have better system performance, and we'll spend more time talking about some of the elements of that system performance. But you also need better professional development. And as we can see from this very nice diagram, they're all inextricably linked together. They all affect each other. And so this dynamic interplay between better patient outcomes, better professional development, and better systems performance requires that everyone have the will, produce the ideas, and be willing to execute the changes needed to really produce a high-quality healthcare system. Turning now to this concept of clinical microsystem, I want to provide a definition and demonstrate how this is truly the building block for both clinical care and education. As we can see from the slide, a clinical microsystem can be defined as the combination of a small group of people who work together on a regular basis to provide care and the subpopulation of patients who receive that care. Importantly, as Eugene Nelson, Paul Batalden, and Marjorie Godfrey point out, it has clinical and business aims, linked processes of work and care, and a shared information environment. And it produces services and care that can be measured as performance outcomes. So what characterizes a successful microsystem? Well, Paul Batalden and Eugene Nelson and his colleagues have spent a fair amount of time investigating successful microsystems in many different settings and have determined that there are 9 key success factors. And I'd like to kind of walk you through each one of those. The first is that you have to have a robust information and information technology system. It's not that the technology is the system, but is the critical hub and facilitator that enables the system to work most effectively and efficiently. Second, you have to have effective leadership of the microsystem. Leadership remains important, particularly in the context of servant leadership, where our goal is to make sure that microsystem works up to its full capability. That same concept also applies to educational leadership. Third, you need macrosystem support of the microsystem. That includes the institution, the community, and also federal and state policies to make sure that the microsystems can work, again, at their full capability. Fourth, and perhaps most important, the microsystem has to have a strong patient focus as its central idea. Patients are why we're here. And so without a strong patient focus, microsystems can really lose track of what their primary purpose is. Fifth, the staff also need to focus on their own competence and roles. And roles need to be clearly defined, and there needs to be attention to making sure everybody has the competence they need in order to function effectively. This also means that we probably have to rethink some of the roles that traditionally have had fairly bright lines between them, such as nursing, nurse practitioners, and physicians. It's clear that each of those individuals, for example, can now do things that 30 years ago might not have been possible. Sixth, interdependence of the care team is critical. We now know, and we've really always known, that you can't provide high-quality care without having an effective team. The team has to be tightly linked together. That interdependence is critical to its success. And so relationships and competencies among the care team members is very important. 7, you need to have ongoing process improvement. Nothing ever works perfectly. And so you have to work very hard to look at processes to continually improve them as things change within medical knowledge, medical interventions, and also just the way we deliver care. 8, education and training the staff is also essential. We see medical education as essential for our trainees, and we often don't pay as much attention to our own education training as faculty or staff to make sure that we're acquiring the competencies necessary to be most effective. Things change, so we need our own continual professional development within the microsystem to make it work very effectively. And finally, performance results. We have to measure what we do. And we'll come back to this theme, but you have to be paying attention to what you do and how well you do it. And so measuring the results of your performance is also a critical aspect of a successful microsystem.